Okay, guys, I'm back. So I'm just blow drying my hair. Oh, yeah. I just, try to do it when it's kind of wet still. That way I don't have to use the flat iron anymore. Um, it's just a little bit less damaging. Um, I do have a lot of volume though. But the reason why I'm here for is to encourage you. Every human being needs a psychiatric provider, whether it's a therapist, a psychiatrist, a psychiatric NP like me. Just even if you feel okay, mental health is everything. It really is. And you should absolutely, like, it makes me, I'm amazed at some people who are like in their 30s, 40s, and they have never seen a psychiatrist. Like, wow, that's really, like, that right there shows you that the stigma has been going for centuries. Getting an appointment with a psychiatric provider doesn't mean that you are crazy. Nobody is crazy. Nobody is crazy. Like, I wish they used that word for something else and not like correlated to mental illness or mental disorders. It's absolutely a big no-no for me. I don't think anybody's crazy ever. Like, I actually don't even use, I'm only using this word right now to be specific for this video, but this is a word that I actually don't use in my vocabulary at all. I mean, if I ever use it, it's to say that something is like unbelievable, but never to refer to like a person or anything like that. I think that's looking better a little bit. I found this. I've had this for like, gosh, so many years, and I haven't used it before, but I actually like that it kind of takes away the frizz on my hair. Fructis Garnier products. This is a not paid promotion, okay? Oh my God. Anyways, I want to encourage you. Please look for help. There's so much help. We're all here waiting to help you. We want you to feel your best and think the best of yourself and live your best life, because that is what you deserve. Don't fall into the stigma of, oh, I feel, you need help. You know you're sad. You know you're anxious. But don't fall in that loop of, oh my God, if I were to look for help, it will actually make it real. Or it will actually mean that I'm crazy. No, it just shows. Every time I have a patient who comes to me, whether it's for the first time in their 20s, 30s, 40s, 50s, 60s, 70s, I gain so much respect for them, like immediately, because it just shows how much courage it takes, how much proactive you are to take care of your mental health. And I think that's beautiful. That is so respectable. I love that. Actually. It just shows how strong you are. Like, it shows the strength, it shows that you have excellent insight and excellent awareness. Like, if you haven't made an appointment with a psychiatric provider, make an appointment with me. I'm in Florida. I'm a board certified psychiatric NP in Florida. I would love to help you. I pride myself in always making sure I have a few spots available every week for patients, because I will never allow my practice to be a practice where, like, oh, I'm sorry, we cannot see you. We're booked out 6 months in advance. Never. If that were ever the situation, I will hire more NPs, like, to make sure I always have availability, because I want to bring mental health to everybody. As a matter of fact, I feel like, I don't know why the government doesn't cover this, in the sense of, like, it should be like a birthright in my eyes. This is Lily opinion. Like, you're born, you instantly should have free access to mental health, even more than physical health. Because if you don't have mental health, guess what? You're not going to have physical health. You're not going to have any type of health in your life. And I am amazed, and in a really particular way, in a really surprising way, not in the best way, of course, of how society praises physical health. Of course, it's important. I'm not taking from that. I will never take from that. But you're going to tell me that for centuries, mental health has been disregarded. Mental health has been a stigma. Mental health is a privilege. No, no, no. It should be the other way around. If anything, is I don't wish any stigma upon any type of health. We are all humans. Should all be deserving of having health access. But when it comes to psychiatry, to mental health, I do feel strongly there should be an exception. It should be an exception, because once you develop a mental health disorder, it's not going to get any better until you find help, until you get on the right medications. These are disorders that are characterized. There is evidence-based practice, articles, research that supports this. The brain, if you don't treat these mental health conditions, depression, anxiety, panic disorder, bipolar, schizophrenia, it's just going to make your brain worse. It will make your brain sick. And the longer or the more years you go by without getting medicated, because this is neurobiology. We're talking here neurotransmitters. We're talking here chemical interactions, biology. Like, this is science. If you don't bring your brain back to homeostasis, to balance, you will pay the price at the end, in the sense of like, all the neglect, if it's your option to not look for help. Some people really don't believe in science or mental health. It will make it so much harder for you to get better at the end. So that's why I'm encouraging everybody. You feel like you're having rumination, you're having thoughts, you're having, non-dystonic, like I would call like dystonic, like thoughts. It just doesn't correlate to your actual emotional state of mind, of emotions. And that can bring a lot of distress in your life. Get help. Reach out to me. Reach out to any psychiatrist, MP or psychiatric that you have around in your community. Like, you're not alone. We're here to help you. You don't have to go through this alone. The sooner, the quicker you get on the right medications, your brain will thank you. It will make your life better, easier. And it will also make it much easier for us to treat your condition. Because let's be real. This still surprises me. The fact that you go to the GI doctor and the GI doctor is like, okay, we gotta do an endoscopy. We have to go down through and see what's going on. You break a bone or fall. Okay, we gotta do an x-ray. Let's see if this is a fracture or anything. But when it comes to psychiatry, you're telling me that I cannot order a CT scan of the brain to rule out other organic causes before I diagnose a person with depression? Wow. Like, this is mind-blowing if you really think about it. And this is why I try my best to really find the root of the problem. What is really causing these symptoms in my patients, so I can provide the best care possible for you. I would love to order a CT scan of the brain for every single patient that comes to see me, because in psychiatry, it's by the DSM-5. Before you diagnose a mental health disorder, you have to rule out any organic cause, any physical illness that could be causing those symptoms. For example, if somebody is ever having any heart problems, heart issues, cardiac decompensation, anything, however you want to call it, they can present with chest pain, right? Tachycardia. And especially the person is a young person, oh my God, yeah, they will think they're having panic attacks. But then they go to the ER, they do blood work, they do a cardiography, everything that they have to do. And they realize, they do all this diagnostic testing and you never had panic attacks. Your heart is enlarged, or you actually have some blockage in your arteries. So that is something that I'm like, wow, okay, wow, I wish the insurance companies, psychiatry would go through like a revolution where we could just make it better. Like, in the sense of like, as providers, just like a GI doctor can scan the abdomen, just like the radiologist can scan extremities for the bones to see the internal structures, we should, as psychiatric providers, be able to scan your brain to actually verify that there is not another organic cause causing your psychiatric symptoms or illness. That is what I really think would be the norm. That should be the steps. And I know whether it's in 5 years, 10 years, 20 years, a century from now, that's how psychiatry will be. I have zero doubt that will come one day. It's still not here. It should be, like with the other, you know, aspects of the medical care teams. It just amazes me that we can really not, it's not like a routine exam that the insurance will cover. Really? Like, wow. Anyways, just reach out for help. That's all I care about. Whether it's with me or somebody else, it doesn't matter. But reach out for help if you need it.